medications for managing tobacco and alcohol use. It's kind of interesting is that we talk about addictions and behavior changes, and we're going to explore a little bit some ideas about how to manage. Everybody knows tobacco is no good for you, but most people don't realize that alcohol is a type 1 carcinogen, and it's something we need to think about what to do about that. So take it away. We have the team put this together. Who's going to be leading off today?
That would be me.
Great.
So,
Tell us. Go there, Stuart.
all right, well, thank you so much. So in today's webinar, our team is hoping to take a look at medications for managing substance use. Now, today is not meant to be a lecture telling you how much you should be drinking or smoking if you're drinking or smoking too much, but rather we just want to discuss patterns of substance use that are very common in people and share some resources and perspectives that you might find helpful for yourself or a loved one. So without further ado, I just want to go into very briefly the topics of discussion for today on the next slide. So first and foremost, the first topic that we'll be discussing is substance use. What exactly is substance use, and what is this term that we often hear associated with substance use, cravings? Next, we want to talk about pharmacotherapy. When should you be looking towards using medications for help? When should you consider consulting your family doctor or your cardiologist or whoever is taking care of you about whether medications might be right for you? Then we're going to talk about the different types of medications for tobacco use, as well as the different types of medication for alcohol use. We'll touch very briefly on some resources in the community that you can reach out to for help, and what are some other ways that you can try to quit. And then we'll conclude today's presentation with a nice wrap up on the importance of building a solid support system around you and how this can really help you reach your goals when it comes to managing your alcohol and tobacco use if you deem it something that you want to work on. Next slide, please. So before we get in, we're going to be talking about a lot of information today, and many people like to have a condensed document, which is sort of compiling everything we'll be discussing. So we've gone and taken the liberty to make a summary sheet of all of the topics we'll be discussing today, which you can find in the description of today's video, if it's something you'd like to look into in the future. Next slide, please. So what exactly is substance use? What qualifies as substance use disorder? What are some stats that have sort of been prevalent during the pandemic when it comes to substance use? And in terms of our bodies, what are the negative effects that it can have on us? Next slide, please. So addictions itself is multifaceted, but cravings and triggers have a lot to do with why people keep using drugs and why addiction can feel so challenging to overcome. Some definitions of cravings, which are associated with drug use, include a state where a person is focused on acquiring the drug, the desire to use a drug given the opportunity, or the psychological want for the positive effects that this drug gives. Triggers are also important to consider when talking about cravings and addiction. A trigger can be defined as a stimulus that sort of sparks this idea in our head, this craving that we would like the substance. Triggers are the people, the places, the things that make you want to use the drug or drink more alcohol. And typically they are categorized into three subtypes. There's patterns, such as a certain time of day, a season, a weather, significant life-altering event. There's social or emotional, which is associated with maybe you're involved in large groups or a single person associated with the use or feelings related to drug use. And finally, there is withdrawal, which is the biological response to a lack of obtaining the substance in the body. Now, on the next slide, we'll sort of talk about the biological response that is happening on our body when we're consuming a substance. So the early draw to drug use for most people is the pleasurable feeling that it delivers, a feeling that results from electrical stimulation of specific areas of the brain that make up what is collectively known as the brain's reward center. So neurotransmitters are these things that unlock the electrical stimulation in our areas. And the common neurotransmitter associated with reward is dopamine. It's a neurotransmitter that's strongly associated with pleasure and feelings of reward, and typical use of drugs and substances can lead to dopamine overflow, which can strongly become an addictive sensation, with the association leading to higher and more frequent drug administration in order to sort of experience the pleasure that the reward response was delivering to you in the first place. So the intensified dopamine response in the brain doesn't naturally stop once the behavior is started, and as a result, this is how cravings are sort of formed. Cravings for the reward associated with the drug administered, even during drug use, can lead to compulsive, sort of repetitive use. And finally, with continued long-term use, this results in the brain reducing the number of neurotransmitters in our brain to adjust to the increased dopamine in our systems. This can sort of lead to this positive feedback loop where you keep on coming back to the substance more and more to get that pleasurable feeling that it was once delivering to you in the first place. On the next slide, we're going to be talking about what technically is considered substance use. And before I get into this, I think it's important to first mention that when it comes to discussing substance use, it's not necessarily a choice of someone, but often it's a need. It's a biological response that your body is craving to use a substance. And so there's oftentimes a stigma associated with substance use, but that's something we'll be getting into a little bit more in today's presentation about the stigma associated with it, and how this can be also detrimental to your chances of trying to overcome these challenges. So substance use is the medical term used to describe a pattern of use that causes significant problems or distress. This can lead to, for example, missing work or school, using the substance in dangerous situations, such as driving a car. It may lead to substance-related legal problems or continued substance use that interferes with friendships, family relationships, or both. It may be abuse of legal substances such as alcohol or prescription medications, with alcohol being one that is very common, a very common legal substance of abuse. And as noted in this illustration, there are many implications of substance abuse that may be explored in upcoming slides, such as cravings, wanting to stop but unwilling to do so, or even using substances even when it puts you in danger. On the next slide, we're going to be going into what the DSM deems a criteria for substance use disorders. Now, it's important to note that the DSM-5 recognizes that people are not all automatically or equally vulnerable to developing substance-related disorders. Some people have lower levels of self-control, which predisposes them, for example, to developing substance use issues in the future. Secondly, the criteria for substance use disorders may vary in their applicability to older adults, as you can see on the screen here. And for anyone who's watching this video in the future, you're more than welcome to pause the video right now and have a look at some of the criteria that are listed in the DSM and sort of ask yourself, or if there's anyone else that you know that may relate to some of these criteria listed. This is often a good way for you to sort of reflect on yourself and see, in what ways do I relate to the criteria and what ways do these not apply to me. On the next slide, I want to present a case study. So now that we've looked at what the DSM-5 is saying, it's important to sort of apply this to a real-life situation. So this is Jane Doe. She's a 51-year-old female who drinks about 6 to 10 times a day. The alcohol content of her drinks ranges from about 12 to 30%. She consistently tells herself that this is going to be her last day drinking so much, but fails to stick to this conviction. She starts consistently showing up late to her old job as an accountant, and was not completing her responsibilities on time, so unfortunately she was fired and was not able to get a new job since. Her drinking has put a lot of strain on her relationships, as her siblings, partners want her to stop, but she feels like they are being unreasonable. She stopped going to family events because of this. So how would the DSM-5 apply to Jane? Well, Jane fulfills the criteria for many of the substance use disorder criteria, such as substance taken in a greater amount than intended, or there's a persistent desire and an unsuccessful effort to cut down on the substance. There's repeated use, which leads to an inability to perform her roles in the workplace. And there's use that continues despite negative consequences to her social or interpersonal life. So since Jane here meets 4 of the 11 criteria, this is sufficient to be diagnosed for a moderate substance use disorder. It's interesting to note that meeting 2 or 3 of the 11 criteria in a 12-month period would be sufficient for a diagnosis of a mild substance use disorder. And meeting 4 to 5 is sufficient for a moderate. And finally, meeting 6 up to 11 is sufficient for a severe alcohol disorder. Now, it's important to also recognize that this is a very didactic approach to understanding substance use, and oftentimes there's a lot of factors that the DSM-5 really isn't able to capture, such as the emotional aspect associated with it, or the financial situation that you may be in, which may also be existential factors which have an influence on your consumption habits. And that's why we don't necessarily use this as a way for you to reflect on it, but really just to recognize what the science is currently saying when it comes to understanding substance use disorders on a scientific, objective level. So on the next slide, we want to talk about the CAGE substance use screening tool. So this screening tool is used by physicians, oftentimes to assess substance use disorders. Item responses on the CAGE questionnaire are scored either as a 0, meaning no, it doesn't apply to me, or a 1, meaning yes, this does apply to me. A total score of 2 or greater is considered clinically significant, but there is discussion about lowering the threshold score to 1 to include more people who may be struggling with substance abuse. We have an extremely comprehensive video on recommendations, risks, and causes about drinking, which discusses this questionnaire and the effects of alcohol in much more detail. So we do encourage you, if this is of interest to you, to check out that video, which I'll be showing you on the next slide. And also, if you're watching this in the future, you're welcome to pause this and ask yourself these questions to see what you would rate yourself when it comes to the CAGE score and whether you are qualifying as 2 or higher, which would be considered a moderate risk.
Stuart, I find this questionnaire helpful, and I find one of the most important questions is that, have you ever felt annoyed when people talk about your drinking? I find that very important because most people who have a serious drinking problem initially don't think they have one, and they get annoyed. So if someone in a caring way is worried about your drinking and you're annoyed, you probably have a drinking problem. Or other substance problem, or I have a sugar problem. I'm addicted to sugar. I'm addicted to nighttime eating. So we all have our strengths and weaknesses, and so just think about this. And it's something that, if someone around you is worried about you, chances are there's something not right. So just think about that. Just pause. And you won't think you have the problem initially. Go ahead. Sorry, Stuart.
No problem. And that's a very interesting segue to sort of an interlude I want to discuss. While this is perhaps a different topic, obviously substance use comes with its own stigma, and it's important in our society to sort of break down this barrier of stigma. It's the best way that we can both help ourselves if this is something we're dealing with, or we can help someone else who may be also struggling with alcohol consumption or tobacco use. And I just want to provide a few, suggestions or things to consider when it comes to sort of breaking the stigma or even opening up conversations within yourself or with a family member. So first, it's important to sort of humanize substance use, alcohol, tobacco use, or even mental health concerns, which often comes with its own stigma. Educating people on why someone may be developing a craving or an independence, and addressing misconceptions about it with other family members or friends is something that is definitely important. These small-scale conversations can often lead to something far greater. Focus on the individual and not simply the action or the behavior in which they're indulging in. Highlight the many ways an individual contributes to the community in a positive way, and ask yourself what feelings you harbor towards substance use. When you think of substance use, do you automatically have an adverse negative reaction? If so, then it's something to maybe sort of reflect within yourself and find ways to sort of reflect on it and think about how you can be helpful towards others and yourself in addressing it, rather than just sort of judging it from an outside perspective. And with that said, I do want to go on to the next slide, where we're going to be just sort of briefly discussing another diagnostic reference guide, which you can use in your own time to sort of assess your criteria for how closely you or a family member or a loved one may relate to substance use. We've provided the link in the description of this video. You're more than welcome to click on the link, print this out, share it with a friend, or fill it out yourself. And sort of just reflecting, being honest within yourself, and then coming up with a final score and seeing where you lie on the spectrum would be is certainly something that would be beneficial for you, at least to sort of get into the contemplation stage of whether or not this is something you want to work on for yourself. And with that, I want to go on to the next slide. Here I just want to talk about why it's often difficult to control addictions and what we can do about this. So most drugs affect the brain's reward system, as I've talked about, by flooding these chemical messengers, dopamine. Surges of dopamine in the reward system cause the reinforcement of pleasure, but sometimes unhealthy activities, leading people to repeat the behavior over and over again. Over time, the brain adjusts to this dopamine, which reduces the sort of pleasurable sensation that you get, so people often have to indulge in the behavior more and more often to get the same positive effect that they were enjoying. Long-term use can cause changes in your brain, such as your chemical systems, your circuits. It can affect your functioning, such as your learning, judgment, decision-making, stress, memory, mood, behavior. However, the good news is addiction is something that is treatable and it can be successfully managed. And it's important to note that no single factor can predict whether a person will become addicted to drugs. A combination of genetics, your environment, developmental factors can all play a certain role in it. And the more risk factors a person has, the greater the chance of taking drugs, which can lead to addiction. So no single risk factor can predict if someone will be addicted to drugs. But fortunately, and as we're going to be discussing now, drug addiction is something that can be treated, can be managed, and can be overcome. So next slide. I just want to conclude my section by talking about the global pandemic, which we're all in. The ongoing stress and uncertainty from the pandemic has certainly brought forward many unique challenges and mental health concerns. But depression and anxiety weren't the only issues that we faced. There's a rise on the opioid crisis and the misuse of substances and stimulants as people have fewer ways to sort of manage the stress and find ways to cope with the anxiety that they may be feeling. Now, on top of the other risks arising with substance use, those with substance use disorders are both more likely to develop COVID-19 and also experience worse COVID-19 outcomes, including higher risk of hospitalizations and mortality. According to the Center of Disease Control and Prevention, 13% of Americans reported starting or increasing substance use as a way of coping with the stress of the pandemic, but there are also practical pandemic-related reasons for the rise in overdoses. Certain parts of America say people are more likely to die when they're using drugs alone because there's no one there to call for 911 or to administer opioid reversal agents. So for those living alone during the pandemic, this isolation presents an obvious elevated risk. So what are some solutions to combat this? Although there's no FDA-approved medication physicians can use to help patients recover from use of stimulants, such as cocaine or methamphetamines, there's a number of behavior-based interventions, such as cognitive behavioral therapies, which psychologists can use, and you're more than welcome to look into them as well. And we're happy to share some resources for you if that's something that's of interest to you. We'll be sharing our email at the end of the presentation if you'd like to reach out to us for more information on that. Next slide, please. And finally, this study looks at the negative effects on cardiovascular disease. Of course, we are volunteers for Dr. Kearney, a cardiologist, so it would be fitting to talk about this. This study looked at the burden of substance use among patients with heart failure and its association with more emergency department visits and hospital administrations. So as you can see in the figure on the left, it shows that the trend in substance use among patients with heart failure from 2006 all the way to 2016. You can see that the annual incidence of substance use disorders among patients with heart failure treated in University of California, San Diego are plotted here. Note that opioids are the highest noted substance associated with heart failure, and then methamphetamines followed by alcohol. So the study found that substance use to be independently associated with a greater risk of emergency department visits, hospitalizations for heart failure, and hospital readmissions for heart failure as well. Despite being younger on average, patients with heart failure with substance abuse had similar or greater rates of comorbidities than patients with heart failure without this history of substance use. We're talking about rates of hypertension, diabetes, chronic kidney failure were all associated. And moreover, many used substances are also known to exert toxic effects on our body. For example, alcohol has been associated with hypertension. Of course, we know the association with palpitations, atrial fibrillation, alcoholic cardiomyopathy, just to name a few. So cardiovascular complications of substances are being increasingly recognized, and that's why it's important for you to also consider the benefits of cutting down on your use if it's a concern to you, not only just for improving your functionality, your memory, but also improving your cardiovascular health.
And if we go to the next slide now, I know we talked a lot about substance use, addictions, and cravings, but I'd also like to bring your attention to some of the existing videos that we already have on our YouTube channel. So if you click next, this is just one of many, but we have smoking cessation medications, more on exercise and smoking, how to quit smoking if you want to, a specific video on nicotine replacement therapy, and as we mentioned previously, a very comprehensive video on alcohol consumption and awareness. So again, if you're personally struggling with alcohol use or tobacco use, we do encourage you to consult some of our videos from before to expand your knowledge and to see what are some strategies that you can potentially try. Okay, so now moving on, I'm just going to talk specifically about pharmacotherapy for substance use. So when do medications or prescribed drugs come in, and are they effective in helping us manage our addictions? So next slide, please. The general principles for effective treatment in substance use has many different components. So first thing that I want to make clear for everyone is that no single treatment is right for everyone. So when it comes to treating substance use or addictions, it's very important for it to be personalized to the individual and to come up with a long-term plan. And so the medication assisted detoxification is usually only the first stage of treatment to help with withdrawal symptoms, and they should be combined with behavioral therapies in order for long-term sustainment. And as I mentioned previously, treatment plans must be reviewed often and again modified to fit the patient's changing needs throughout the period of time. And evaluation and treatment of these co-occurring mental health issues is also another area of focus, as those who are trying to quit their substance use tend to also experience depression or anxiety, which may need medical treatments. And lastly, long-term follow-up to prevent relapse is once again extremely important, and that can also involve other community or family-based support systems, which we'll briefly touch upon at the end of our presentation today. And so now that you've seen the general regimen for treatment and what makes an effective treatment plans, where exactly do medications or prescription drugs come in? The first is managing withdrawal symptoms, like I mentioned before. And this is usually the very first step that occurs during detoxification. And this is where the patient is typically given a medication in the same category as the substance of dependence. So for example, take tobacco. The first step is usually nicotine replacement therapy, in which nicotine is a specific component of tobacco itself. And once the patient is given this medication, it's usually titrated down so that the patient can gradually quit rather than just quit cold turkey. But of course, we have a whole nother discussion on quitting gradually versus quitting cold turkey that's present in one of our other videos. And the next part where medications come in is for relapse prevention. Now, this happens after the withdrawal stage, and it's used to reestablish normal brain functioning. And if you recall what Stuart mentioned earlier in terms of the brain reward pathways, medications here, such as nicotine replacement and also naltrexone for alcohol use, are used to decrease cravings and reestablish these reward systems. So essentially using it as a reset to those neurological pathways. And lastly, the medications are also used to treat co-occurring conditions such as anxiety and depression and other possible mental health conditions. So these are mainly the selective serotonin reuptake inhibitors, some of which you might be more familiar with are citalopram, paroxetine, and sertraline, or you may know them as their trade names, which are Celexa, Paxil, and also Zoloft. And next slide, please. So you might be wondering, well, I'm trying to quit one addiction, but isn't taking medications just trading one addiction for another? And the answer for this is no. So if you click next, all medications that are used for treating substance use disorders are approved by the FDA, and specifically for alcohol dependence, they're proven to be non-addictive. So even if you're taking nicotine for tobacco cessation, it is completely different from tobacco and it's nowhere near as addictive, and it will be titrated down until you are no longer dependent on it. So do not worry, you aren't just trading one addiction for another. And on the next slide, again, addiction is a chronic condition. So treatment of addiction is actually treated as a chronic disease. And just like how you have to take cardiovascular medications to treat your chronic cardiovascular conditions, patients would also need medications to treat addictions in the long run. And again, treatment using medications should always be paired with counseling or a fully structured treatment program in order to ensure long-term recovery. And if you click next, the primary one that I like to bring your attention to is CBT, or cognitive behavioral therapy. And this is a form of very effective psychotherapy that is usually delivered by professionals such as psychologists and therapists, in which patients sit in one-on-one with their therapist or psychologist and learn how their thought processes contribute to their behavior. So it's a very introspective process in which you're guided by the professional to identify and change some of the maladaptive thought patterns and emotions you may have in association with addiction. And the psychologist will then help you come up with a personalized plan where you can learn how to adjust and rewire your thought process and change these maladaptive thoughts to growth promoting thoughts. Okay, and the next section will just be jumping right into medications for tobacco use. And in this section, we'll be talking about the specific prescription drugs that you can take to help address tobacco use and also smoking cessation. So one substance abuse disorder that challenges millions of people across the world every year is smoking. And so while there's been a decrease in the prevalence of people that smoke over the past few decades, over 19% of the world's population continue to smoke. And this is why we'd like to just focus on this section in our presentation today as well. So next slide, please. Yeah, and the first common type of smoking cessation medication, which I also mentioned a few times already, are nicotine replacement therapies, or just known as NRTs. And since smoking addiction depends on nicotine supply, these treatments are first used to replace cigarettes, which contain many harmful chemicals such as the smoke itself. So once again, nicotine is the one specific component involved in the reward pathway without the other harmful components. And over time, less and less dosage of nicotine are taken. And as a person starts to use these therapies more progressively and less frequently, they're eventually able to get off of the nicotine completely and to no longer be dependent on this product. And as you can see in this picture here, NRTs can come in many different forms. The most popular one is the nicotine patch, but there are also nicotine gum, sprays, and also lozenges. So it's very important for you to also consult your pharmacist to see what options might be available to you that suit you the best. And taking a closer look at the different types of NRTs, again, we have our gums, lozenges, patches, and also mists or sprays. And one thing I'd like to point out here is the relative price comparison. So all of these are usually available over the counter at your local pharmacy. And the prices that we took here are just from Shoppers. And as you can see here, they're decently inexpensive, although patches may be the more expensive one out of the 4 options. So again, depending on your financial stability and what you need the most, you can choose your option and weigh it this way. And as for long-term medications, so nicotine again is short-term withdrawal, but an alternative to NRTs are anti-addiction drugs, which try to completely replace the dopamine reliance on nicotine by removing it from the patient's system. And these are often in the form of other drugs that activate dopamine reward pathways in the brain, which thus reduce the negative effects seen with nicotine withdrawal. And 2 common examples of these that we'll touch on today are Zyban and Champix. And Zyban is also more commonly known as Wellbutrin, whereas Champix is more commonly known as bupropion, which is the generic name. So starting off with Champix, we're looking at the acetylcholine receptor agonist. And it works by binding to the acetylcholine receptors in the brain, which then causes a release of dopamine in the brain's pleasure centers. And when taken to help with smoking cessation, this can then act to progressively decrease a reliance on nicotine-based dopamine over time. And the cost for Champix is about $3.60 a day. And this is taken from the 2012 version of the Ministry of Health and Long-Term Care document in Ontario. And so, yeah, it's relatively inexpensive and it's very effective in helping you manage the reward pathways and in managing your cravings. So once again, you can speak to your physician, your family doctor, or whatever other physician you have to see if they can write up a prescription for you for a Champix set or a Champix kit, which usually lasts about 8 weeks or 12 weeks that you can then get from your pharmacy. And the next option we have is Zyban or Wellbutrin, and the generic name for this is bupropion. I just like to correct myself from earlier, sorry. Bupropion is for Zyban and not Champix. So Zyban, on the other hand, is actually an antidepressant, and it acts to release dopamine in the brain by mimicking the binding of nicotine to its own receptor. So the success of either form of medication varies from patient to patient. Wellbutrin is sometimes not prescribed to patients with other cardiovascular diseases because it can potentially increase blood pressure, but it is a very effective drug to reduce nicotine addictions and cravings.
So, Maria, so in people who have cardiovascular disease, I think always all these drugs are much better than smoking. It's always said that every time you smoke, you lose somewhere around 5 minutes of life. People who smoke, 60% of smokers will die from a tobacco-related illness. So the rise in blood pressure is not a serious concern in my mind. That's very manageable. It's not a big problem most of the time. The only thing is that people have seizures disorders, you have to be careful about this. And it's also a wonderful antidepressant too as well. So a lot of people say that, they're depressed, their cigarettes are their friends. They're better friends to have. So thanks for sharing that.
Yeah, exactly. And when looking at the side effects of all of these medications before we go into alcohol use, you're comparing these minor side effects versus chronically using the drugs such as tobacco or alcohol, which can have a much more negative impact on your health than some of these potential side effects can.
And one thing to remember is depending if you use generic or trade name, same thing with Champix too, as well, the price is substantially less as well. And for those over the age of 65, or those are paid for the Ontario government, they are covered once a year as well. But not nicotine replacement therapy for whatever reason. The other two are, but thanks.
Okay, so I'm going to be touching on the medications for alcohol use disorder. So as we touched on earlier, the initial treatment normally for like a mild disorder often involves brief motivational counseling and mutual help groups. And the goal of these sessions is to increase the motivation to change drinking habits and engage in treatment. And then for something or a more moderate or severe disorder, the medications often involves a combination of pharmacotherapy and psychosocial interventions. So in the next few slides, we'll be looking at some of those medications. So we're going to start with naltrexone, and it's referred to as a first line of pharmacotherapy when addressing alcohol use disorder. So it's essentially an opioid receptor agonist, and it blocks the mu opiate receptor, and this reduces the amount of dopamine released. And when we reduce the amount of dopamine, it causes a decrease in that reward pathway we were talking about earlier. And it reduces the positive effects of substance abuse and decreases development of cravings and maintenance. So moving on, we found a few studies that looked into naltrexone, and they compared it to a placebo, and they used 107 patients that fulfilled AUD according to DSM. I believe at the time it was the 4th edition, but still fairly relevant. And those taking naltrexone had a 0.55 times risk of relapse, so it was about 50% compared to the control group. Their time to first relapse average is about 90 days versus 42 days, so obviously a little bit longer. And then there were fewer side effects. So the study talked about how headaches were more common in those taking placebo versus those taking naltrexone. And that was something that I found pretty interesting about the slide. So just to kind of look at this graph on the side here, the key points is that naltrexone has a reduced risk of relapse, and it also has a longer time to first relapse while minimizing those side effects. So just for some information on naltrexone, according to, this was about a 2010 report, the price of a tablet, or the cost of one tablet, is about $5.30 for a 50 milligram tablet, and that's approximately $1,952 annually. For the first administration, it's normally about 50 milligrams once daily, and then you start at 25 to minimize side effects. Some cautions are you must be opioid free for 7 to 10 days. You can't obviously have liver failure, current or anticipated opioid use, or sorry, I'm just can't see that last point. Hypersensitivity, sorry. And naltrexone can be prescribed and administered by any practitioner licensed to prescribe medications. So this isn't one that you could get over the counter. Instead, you would have to get that prescription first. Moving on, so acamprosate is the alternate first line of pharmacotherapy, and it modulates glutamate transmission. So this drug would act on your glutamate receptors, and essentially it reduces cravings, insomnia, restlessness, and anxiety of coming off alcohol. It modulates the glutamate transmission by acting on NMDA and or metabotropic glutamate receptors, and therefore it reduces excess glutamate activity and then therefore blocking excessive alcohol consumption. So in this study, they again compared acamprosate versus a placebo, and they found that it led to a higher abstinence rate and a longer time abstinence. So very similar to the previous study, you stayed abstinent, which essentially means you didn't go back to alcohol. And they found that based on the graph, based on this bar or this line here, it's much higher than the placebo bar. So just some information on acamprosate. So it cost of one tablet is about 80 cents for a 333 milligram tablet. And again, this is according to the 2010 report, and then it would be about $1,800 annually. It's dosed at 666 milligrams. And then there's also a lower initial dose recommended for those with moderate renal impairment, which is about 333 milligrams. Again, some of the cautions when taking this drug is if you have severe renal impairment, pregnancy, or hypersensitivity. And again, it must be prescribed by any practitioner licensed to prescribe medications, not an over-the-counter drug. So now moving on, so we're going to look at some second-line agents. And these work more on a long-term scale. So those first two that I addressed kind of are more right away, and they work for kind of the first couple of weeks or couple months, but these ones are kind of more long-term. So we're gonna start with, there's three. So there's disulfiram, topiramate, and gabapentin. So we're gonna start with disulfiram. So the generic price is about $50 a month. The brand price is about $190 a month. And this is according to 2015 reports. So the dose is about 500 milligrams for 1 to 2 weeks. Then after that period, you would kind of go down to like a 250 milligram for maintenance dose. The important cautions here is it requires total abstinence. And there's also risks involved when taken while pregnant. And again, this one has to be prescribed by a practitioner licensed to prescribe medications. This is an over-the-counter drug. So what disulfiram actually does, it blocks the conversion of acetaldehyde to acetic acid. So essentially what that would do is it causes hangover symptoms very quickly after kind of consuming alcohol. And then this would reduce your desire to drink alcohol. So moving on to our secondary agent, we have topiramate. And this one works by a dual action. So the first, it leads to a dopamine decrease in the nucleus accumbens in response to alcohol ingestion, and can consequently to a reduction of its rewarding reinforcing potential. So it works on that mesolimbic pathway. And then secondly, it minimizes withdrawal symptoms by moderating the effect of chronic alcohol consumption on neural system excitability. And this will essentially reduce cravings. So some information on it. So it's about $10 a month in the generic price and $140 a month for the brand price. The dose is 25 milligrams, and you increase dose according to specific regimens. So it's essentially based on kind of how you're doing. It's lower doses and slower titration recommended for those with renal impairment. And again, another drug that must be prescribed. You can't obviously get this one over the counter. And then finally, the last drug, we have gabapentin, which is $11 a month generic, $200 a month brand. And then again, the dosage here is 300 milligrams, and you're again increasing dose according to specific regimen. Lower doses and slower titration is recommended for those with renal impairment. And again, it must be prescribed. So what gabapentin does is it normalizes the GABA and glutamate activity. It works on that reward pathway that we've been discussing throughout, and it reduces your desire to drink alcohol. And then on this slide here, it's important to keep a medication list. You are prone to medication errors if you are older than 65, taking 5 or more prescribed medications, have more than one prescriber, i.e. like a family doctor with multiple specialists, and have had multiple transitions of care. So you could keep a list such as the one shown on the slide here.
In fact,
yeah.
I think everybody's prone to medication error. You don't have to be over the age of 65. It's something you should take with care. It's kind of funny that most people don't truly understand well their medications as well as they should. You don't understand how good or they are, but when something goes wrong, we want to blame the pills most of the time, and we don't want to blame life for other things as well. So thank you for reminding us to always keep a medication list in your wallet updated. Like I said, if you drive your car, you have an updated driver's license, and you should have an updated medication list at all times, keeping up to date, and make multiple copies. Please, please, please do this. And part of the thing too is know how many refills you have and who's prescribing them. And if you have a problem with a medication, go back to the person who's prescribed it to you first. Work with your pharmacist, but also work with the physician who prescribed that medication in the first place. Thanks for sharing that.
Yeah, thank you, Evan, so much for going over everything for substance use and managing tobacco. I think the main takeaway when it comes to alcohol, when it comes to managing alcohol and when it comes to tobacco is substances or using pills or medications are one way of doing it. And today we also want to briefly touch upon the importance of support programs. I think when it comes to managing substance use, it's a 3-tier system. It's good to use medications for helping the biological processes in your brain and in your body, but I also think having good support system around you, both personally and professionally, are really important. So in the next slide, I just want to talk about some resources which you can work with if this is something that interests you. The first one is motivational interviewing. This is often delivered by a professional such as a psychologist, and they help patients by exploring and resolving ambivalence about change. In one of our previous webinars, we went through the 6 stages of change, where it comes to, the contemplation stage, the pre-contemplation stage, the contemplation stage, the action stage, etc., etc. And understanding that, it's not going to happen overnight. This is something that often takes people many, many tries, getting back up on the horse after you fall, keep on trying. And this is what these support systems are essentially for. Having mutual help groups such as Alcohol Anonymous is available for those trying to manage their alcohol consumption. This is free, readily available, without appointments. I believe throughout the pandemic they've been doing it over electronically, and I'm sure moving forward in the future this will be something that they will again be doing in person. The emphasis on Alcohol Anonymous has always been on group sharing, peer support, and belief in the spiritual basis of recovery. And then finally, telephone helplines and quit lines. These provide brief counseling services, referral to self-help materials, and referral to community resources. And on the slide here, we've provided a number which you can call for addictions, mental health, and problem gambling services. The number is 1-866-531-2600. And on the next slide, I just want to now go over other examples of support groups available. There's group counseling, which offers support to one another through personal experiences, holding one another accountable, effective group support, often moderated or mediated by trained counselors in the area of substance use. There's, of course, family and friends. Having family members on your side, loved ones, people who care about you is really important in your journey towards managing substance use. They help you stay accountable, stick to your goals. Of course, these are the people above anyone else who want the best for you, and they want to work together with you to create a plan to help you with your substance use so that you can continue to sort of strive towards reaching your goals. And when you do fall off the horse, they're there to help continue to motivate you and help you boost your resilience so that you don't give up and you keep on trying. And finally, web-based resources. So these contain self-guided quitting activities and steps. They contain education on effective methods for dealing with addictions, and one of the very common ones in Canada is the Canadian Centre for Substance Use and Addiction. Again, for this, I've provided the link in the description of the video. So if this is something that you'd like to look a little bit more into, you can find a lot of information on their webpage. And for that reason, I wanted to share it underneath this video as a quick way to sort of access that website. And finally, when it comes to smoking itself, what we offer at the clinic is individual smoking cessation help. We've posted a few recent videos sort of outlining what this counseling service that we provide is, sort of going over what a typical first appointment might look like. So if you're sort of having hesitations about this clinic, this program that we offer, or if you'd like to learn a little bit more, then you're more than welcome to check out that video. Sort of get a taste for what these calls are sort of like. These are run by two of our head volunteers, Alan and Subin, which takes place over the phone. These are taking place Friday evenings between the hours of 5 and 7 p.m. And if you would like to join, you're welcome to call us. We've put the number on the slide here. And you're more than welcome to also send us an email. This is the email that we use for joining all of our clubs. It's drkearney232@gmail.com. And finally, we'll be working on a website in the near future, and you'll also be able to learn about more information about all the services that we offer with easier ways to sign up for these programs that we offer just by accessing our website. And once we have that up and running, we'll be sure to tell you so that you're in the loop when it happens.
We're also working on smoking Tuesday afternoons as well. So, and
Right.
individuals are very receptive. Now, looking today is that we called 6 people up, only 2 were available. You see, so you can't get better if you don't play. So just keep trying, and it takes a long time, and it takes a lot of work, but we can all get stronger and better.
And just to conclude, I want to just talk about the importance of having a good social supports around you, having a team on your side, which can include your friends, your family, your healthcare providers. We've talked about it before, but the Harvard Longevity Study is one of the favorite studies that we often like to bring up in our presentations, because it says that one of the best predictors of long-term quality of life is having good quality relationships with friends, family, and loved ones. So having a team who supports you, who motivates you, is there for you in your high moments and also your low moments, can really do wonders to your ability to set your health goals, stick to your health goals, and celebrate your health goals when you reach them. So that's the importance of having a team-based approach to better your health. And that's how we wanted to wrap up today's discussion. Just knowing that, if you are dealing with substance use, there are plenty of resources available. You don't have to suffer through it alone. And we at the clinic offer our own programs, but there are many other programs available to you, which you are more than welcome to explore. And you're more than welcome to come back to this video as much as you'd like to review all the discussions and all the resources that we shared today. Next slide. And with that, that really does wrap up our discussion for today. If you do have any questions right now, you're more than welcome to leave them in the comment section on our YouTube page or our Zoom call, and we can get to them. If you do have any questions or would like to join any of our programs in the future, you're more than welcome to reach out to us. We provided all the ways in which you can on the screen here. And we just want to thank you for your engagement and your participation today. And we look forward to seeing you sometime soon. Thank you.
Well, I want to thank the entire group for that presentation. I like the fact that many of us are predisposed to certain problems, and once this gets into our system, willpower is often not enough. It takes a whole work of communities. First thing is to recognize the problem and to work to get there, and to realize is that if you're a baseball player and you have a 300 batting average, you're a multi-million-dollar player, and we sometimes expect that we should be successful the first time. I love to quote Churchill. Success is the ability to go to one failure to next with no loss of enthusiasm. Remind you that the Allies did prevail at the end, and I think that was a team approach. So find out who's on your side. If alcohol and tobacco or other drugs are your friends, they're not good friends. We got to get you better friends. And there's so many things you can do to change this. So there's numbers out there. There's lots of people who care, want to make a difference. I know it's hard. but I'm very confident that we can all get better and stronger. And I want to thank the group for sharing that. Look at those definitions of addictions and substance abuses there, those 11 criteria, and just think about it. Does that fit anything there as well? I remember many discussions about people say, well, I was able to stop drinking, stop these drugs, stopping these substances for a period of time. And that, and psychologists call that a holiday. Let's make a commitment to change. And if you did it before, you can do it again. And I thank everybody. Any other comments from out there, Stuart? Any comments on YouTube or on Zoom today? No, we're good. Okay. Evan, do you have any concluding remarks that you want to bring in there? Thank you so much for sharing that. Is that, one of the things is I don't know much about medications for substances like alcohol, but you've widened my eyes, and I'm glad that there's more options available. Some of them are very expensive and some of them are less expensive. For smoking cessation, I've seen these things for quite some time. So thank you for enlightening. Anything you came across? Any final comments, Evan?
Yeah, to be honest, because when I started to work on it, I didn't know there was actual physical medications. My understanding was it was always Alcoholics Anonymous and groups like that group setting. And kind of coming across these things and looking into kind of how they work, it kind of really surprised me in terms of just kind of that initial with the naltrexone and the acamprosate, and then kind of those secondary agents as well. A lot of this information was very new to me, and it was very interesting to research. Also kind of the range of options, because the 5 we mentioned obviously are kind of the more present ones, but there are from kind of quick research, there are many more. And it really just depends on the doctor, the person prescribing.
Absolutely. Thank you so much. Stuart, any final thoughts from your perspective?
I always think that this is a funny way of thinking about it, but I think that there are 3 people in your life at least that you need to be 100% honest with, and I always think it's with yourself, it's with your partner, and it's with your doctors. So I think being open to having these conversations with your providers is an important first step, which takes sometimes a little bit of time to build up, to sort of build up the confidence or the conviction to sort of open up this conversation with your provider. But I do think that it's something that is strongly encouraged if you go through the DSM and the different questionnaires that we provided, and you feel like you relate to some of the qualifications that we shared today, or if you were to ask a loved one and sort of gauge their response to your use of tobacco or alcohol, and if they deemed it something that they found concerning, then it's certainly something to bring up to your healthcare provider, or even just some of the resources that we shared with you. With that, that's sort of my takeaways, is just not to sort of feel ashamed about it, but feel empowered to sort of work towards your goals.
So the only time to feel ashamed is if you don't try. Success, again, is basically a process that takes a lot of time. I love the video last week that talked us out how to move into that domain about becoming more successful. I encourage everybody to take a look at that one and all the above. One of the things I want people to create better habits, and one habit is every night spend 5 minutes looking at one of our videos, and I think that would be a great way to help you fall asleep. I know that most nights I fall asleep reading something or whatever, so I'm learning all the time, and we're glad to share as much as we can. So I want to thank everybody for coming. This is one that's, again, looking, if you know somebody that needs help, and if you're concerned about somebody, let them know, and maybe have a look at this together with someone you care for. So with that in mind, we're going to say good night, and we'll see you next week.
All right.
Good night, everybody.
Good night, everyone. Thank you.